Hi, I'm Brandon Steen, orthopedic surgeon with Florida Orthopaedic Associates specializing in shoulder surgery. Today, I'm going to answer some patient questions about shoulder surgery. Here's a question from our DeLand office. What's the difference between anatomic total shoulder replacement and reverse total shoulder replacement? So that's a very good question. I think there are a lot of common misconceptions out there. So anatomic shoulder replacement is very similar to doing a replacement of a hip or replacement of a knee. We are trying to basically resurface the joint with a fresh, smooth surface to reduce pain, improve motion, and reduce pinching. This is a model I have showing what an anatomic shoulder replacement looks like. The anatomy of the metal and plastic we put in looks very much like a normal joint. The articulation is like a normal joint. The shoulder is an unstable joint, and this is an excellent option for people who have a healthy rotator cuff. It still requires a functioning rotator cuff for these pieces to stay in contact with one another. A reverse replacement is really designed for people that have arthritis of the shoulder but do not have a functional rotator cuff. As you can see, it's called a reverse prosthesis because the ball and the socket have now been reversed. And what this does is it creates a stable articulation so that even in a patient without a working rotator cuff, the ball and socket stay in their appropriate position while the muscles try to move the arm. In a patient without a rotator cuff in a regular shoulder joint, the humerus tends to move upwards because the rotator cuff isn't there to keep it in place. So this prosthesis really does an excellent job at helping people that can't raise their arm up because of a unfixable or chronic or recurrent rotator cuff tear.